Dennis, why don't we get started?
Good afternoon. I'm Dennis Galucki, and welcome to the 394th Imagine program and another great virtual Imagine lecture hosted by the Buffalo and Erie County Public Library. Thank you so much for joining us today. This program marks the beginning of our 12th year of presenting the Imagine Greater Buffalo series at the downtown Buffalo and Erie County Public Library. The Imagine program is created by ImagineLifelongLearning.com and the Center for the Study of Art and Architecture, History and Nature, or C-SAAHN, as I like to call the acronym. We're going to start with our speaker shortly, but first, a little housekeeping. Everyone watching will be muted during our speaker's presentation, which will last about 15 minutes. We'll have plenty of time for questions at the end. If you have a question, please type it into the chat box and we'll get to as many as we can. This program is being recorded. You'll be able to watch it again later on the library's Facebook and YouTube channel pages. As a reminder, we'll be here on Zoom every Tuesday at 12:30 p.m. with a great lineup of local speakers. Today's featured speaker is Lucy Connery, Executive Director of the Wellness Institute of Greater Buffalo and Western New York. She took over as Executive Director for Phil Haberstroh in July of last year after the Wellness Institute's 30+ years of success in creating healthy communities in our region. Lucy Connery has experience living, working, and playing in rural, urban, and suburban neighborhoods in central and western New York. As Executive Director, Lucy Connery has focused the Wellness Institute's efforts on three main areas. First, by improving the health and wellness of youth in Western New York. Second, by addressing community walkability and engagement in walking as a form of regular physical activity for individuals of all ages. And third, by providing health education, promotion, and consultation to communities, organizations, and individuals who express interest in the field of wellness. And now, let's welcome Lucy Connery. Lucy?
Hi, everyone. Thank you so much. Happy Tuesday. Happy New Year. I'm very excited to be here and to talk a little bit more about this organization that I just love so much. I've been at the Wellness Institute for about 2 years now, and it's just been such an awesome experience. And I'm just really excited to share it with you. So am I good to share my screen?
Go ahead.
All right. Thank you. So yes, so we are the Wellness Institute of Greater Buffalo, but we do love to go by Healthy Communities 2030. It's one of our biggest initiatives right now. So the Wellness Institute was founded in 1989 by Phil Haberstroh, the man, the myth, the legend. He passed away in November 2020, and it was a huge loss, not only for us as an organization, but for a Greater Buffalo community and, all over the state. So I just want to kind of dedicate this presentation to Phil Haberstroh, and I'm really excited to share his mission and the shared mission that I have with him. So like I said, 30 years, we are 30 years strong and small. So when I joined the Wellness Institute, it was myself and Phil and 3 other members on the team on staff, and then many, many volunteers. We've always had a strong history of volunteers, interns, but we've always been a small group, a small office. So some of our biggest roots that Phil really started for us were our history in workplace health promotion, specifically in civic health and police health. So when Phil first started, he managed the City of Buffalo wellness program for police officers. He managed the Buffalo Fitness Consulting Program. So for police officers and with people that worked for the city of Buffalo, he managed their workplace wellness initiatives, which was really great. So he did that, like I said, for over 15 years. And then also, it's funny because the Wellness Institute is small. And so sometimes people don't know about us, but Phil would love to say, you know us, even though you don't know us, because when you're driving into Buffalo and you see the All America City sign, I always laugh because it used to annoy me. I used to say, shouldn't it be All American City? Why does it say All America City? And it's because Buffalo and the Buffalo Niagara region were awarded All America City designations by the National Civic League. So this is a nationally recognized group. And every year they get hundreds of applications, if not more, for cities that want to say, we're an All America City, which means we demonstrate values that we as a city or as a region can work together, can overcome obstacles, and can demonstrate strong social capital. So social capital is our network of relationships and also the norms of trust and reciprocity in these relationships. So it's not only, yeah, I know my neighbors, but it's also, I know my neighbors, and if I had an emergency, I would drop my kids off at their house and go, and I know that they would do the same, so it's a beautiful thing. And Buffalo and the region have been designated All-America Cities twice, in 1996 and 2002. And so that's kind of something that we're so proud of because Phil really spearheaded it, and it brings recognition to our entire area. So we have those 30 years of history, and in those 30 years, we did a lot of different things. And I'd kind of like to break down how we do what we do, because it feels very complicated, but it's very simple, and it's very strategic and effective, which I love. So we follow best practices. So the World Health Organization's Ottawa Charter for Health Promotion, that launched in 1989 as well. And that was kind of the launch of when the Healthy Communities movement, which is an international global movement, was coming from Canada to the United States. So once Phil Haberstroh basically caught wind of this, he loved it. So the Ottawa Charter for Health Promotion basically outlines 5 activities that can help us promote health. So one is programs. So some programs that we do include our walking events, going to schools and doing physical activity events or educating about mental health. It also includes policies. So something that we were really integral in was making sure that all schools in New York State have to have a district wellness policy. So that's across the entire state. And that wasn't approved before, which is so key because our kids, just like adults at work, spend a lot of their life in the classroom. And so it's important for health and wellness to be incorporated into our school environment. So policies can be really important in facilitating health promotion. Another way to promote health is through capacity building. So something we did just this year was doing virtual trainings. We want to promote walking in our neighborhoods, but sometimes walking can be a barrier for anybody because sidewalks might not be completed, or there might be unsafe signs or things like that, just not complete streets in a way. So we did a training so that individual members could assess their community walkability. Now, it's one thing to teach someone to assess their own walkability, but then we also build capacity and build confidence and empowerment by helping community members bring their data that they collected, their walkability, to public officials as well. So taking that step of taking ownership of your own community, of your own health and wellness, and saying, hey, I have these problems, I can't walk and get active, and then bringing that to policymakers who can make choices about that, which is a really powerful thing. Another way that we promote health is through communication. So whether it's social media, whether it's Zoom, whether it's print, communicating with not only community members, but again, public officials, working intersector to make sure we're all on the same page and all working together instead of working in these silos and working separately. And lastly, the 5th dimension of the Ottawa's Charter for Health Promotion is environmental changes. So it could be as simple as, adding a bench to a park so that people might go in the winter because, being active in the winter can be hard, but making things aesthetically pleasing can help with the utilization of parks, and also, beautifying vacant lots has been proven to show improved levels of social capital and perceptions of safety. So those are 5 ways that we promote health in our communities. And we do this through partnership. Nothing is done alone. So this partnership is with people like Dennis Galucki and C-SAAHN and Imagine. It's also done through partnering with local school districts. So we partner with Buffalo Public School, West Seneca, Lackawanna, Orchard Park. We have relationships with all these different schools locally to promote health for all populations. So although it is a big piece to chew off, I'll call it, we do like to be comprehensive in that we work with youth, adult, and older adult. We work across the lifespan, and we want to make sure that we're addressing all aspects of health. So again, best practices. The 3-4-50 framework is something that we follow, and how can we address health in what ways? The 3-4-50 framework is basically that 3 health behaviors, which include smoking tobacco products, engaging in regular physical activity, and having a balanced nutrition. Those 3 activities contribute to 4 chronic diseases. And those 4 chronic diseases include the big hitters like cardiovascular diseases, cancer, diabetes. And then they contribute to 50% of preventable and premature deaths. So it's a really great framework that kind of lines up, okay, what are we addressing and why? Because those 3 health behaviors are some of the most important to see a huge impact in our health status. So the reason why that's important is because, how do we measure it? It's important in a lot of different ways, but how is that measured then? How do we know that we're making an impact? We use the Robert Wood Johnson Foundation's National County Health Rankings. In March of 2020, they just released their 10th annual county health ranking report. It is so comprehensive. They measure it based on 2 things, on our health behaviors and our health outcomes. So like those chronic diseases, but also how well we behave, how healthily we behave. So we use this as our main metric because we want to see, are we making an impact in our community? Erie and Niagara counties have traditionally been ranked amongst the least healthy in all of New York State. So New York State has 62 counties. The Bronx County has almost always ranked the least healthiest. But Erie and Niagara counties aren't that far behind. We've been ranked 56th and 58th respectively. So the only benefit is that Niagara County's 58th and we're 56th. So we're a little bit better, just kidding. But so we're not doing that well with our health status. So we need to do better. In response to that 10th annual county health ranking showing that in the last 10 years, we've never done better than 50th, we realized we need to be, revamp our efforts. So the wonderful Phil Haberstroh gave me the opportunity of a lifetime and allowed me to take over the Wellness Institute while he transitioned to board chair. And we launched Healthy Communities 2030, which is a decade-long strategic data-driven initiative that's just supposed to really outline our work for the next 10 years. So it includes addressing physical activity, nutrition, and tobacco use. But we also added a 4th dynamic because we thought it was so important, especially with the new decade, especially with all the challenges that came because of the pandemic. We added mental health as a key component to our efforts because I think we all know from last year, our mental health is so important. Our self-care is so important, and taking care of ourselves first. It makes it easier for us to take care of each other, to follow guidelines, and to be safe. So we added that dimension, and I'm really proud of it. I'm very excited about it because it's such an important component of health. So we get this question all the time: how did the pandemic impact your work at the Wellness Institute? We will never stop. Like I said, we are small but strong. We are wellness warriors. And even when the pandemic hit, we were working remotely. We were launching wellness kits for people while they're at home and stuck at home and quarantining. How can we be healthy at home? How can we support local organizations that are working really hard like us, to spread the health instead of the wealth, spreading the wealth of knowledge about how we can impact our health status safely. And so with this new decade of work, we had all these plans. We outlined our focuses to address youth health specifically because our future is youth, and we need to support that health first, but also supporting walking initiatives, because everyone can walk or roll, and we want to make the easiest choices the healthier choices. So getting out and getting active by walking just 30 minutes a day improves your health status measurably. The 10,000 steps a day is a myth. It is actually closer to 7,500, and that's when you start to see the health benefits, and it kind of like tapers out there. So that's, just spreading information about how we can get active, and just kind of letting people know what is known about our health status, like the myth about the 10,000 steps, like how your phone tracks your steps. So even if you don't think you're getting out and walking, you probably are. A lot of this can be really empowering, and that's a lot of what we want to do, is empower our community members, work with our community members to say, because you've got to take ownership of your own health, but you also need support of people like our local government, of nonprofits, of the private sector, to make being healthy something easy. And so with the passing of Phil Haberstroh, though, it just kind of made us reflect on the initiative, reflect on our activities. And we do want to keep promoting Healthy Communities 2030 and comprehensive health and wellness. We do just really want to honor this man, though. So some things to look out for us is honoring Phil by launching our Phil's Mafia campaign. It's a fundraiser, $30 for the 30 years that Phil ran the Wellness Institute, it for anyone who's able or who knew him, just because he was an amazing man that did so much for our community. And also our Walking Warrior campaign. So this is another way to honor Phil, but it's also something that we're really excited about. We want to partner with community members to start their own walks, COVID safe walks. So small groups, neighborhood groups, people that you might already be exposed to, just your family or the people that you're quarantining with. Getting out and getting walking, wearing your masks, whether it's winter or not. There are a lot of great initiatives that we partner with, like the City of Buffalo Winter Mission, which has to do with sidewalk clearances, park activation, again, creating opportunities so that our community members can get healthy and get active. So those are two things we're really excited about. Another activity I'm really excited about is we just recently launched our Wags to Wellness photo contest. Wags to Wellness is in partnership with the White Whiskers Senior Dog Sanctuary Project. And, I could speak to it, but we actually have a guest on today. Paula Milligan. She is the founder and president of the White Whiskers Senior Dog Sanctuary Project, and she could really speak to this amazing initiative, Wags to Wellness, better than I can. So if it's okay, I'd love to send it over to Paula before we take any questions, just to kind of highlight what Wags to Wellness is and how to get involved.
Absolutely, I'm good to go. Did that work? Thank you, Lucy. Appreciate it. So my name is Paula Milligan, as she already said. I was the grant writer at the Food Bank of Western New York for 10 years. I left there to move to the Niagara SPCA as their development director. I retired from there to start a senior dog sanctuary because I saw how many old dogs end up in shelters, and they often do not get adopted because people, and I understand this, don't want to create a special bond with an animal that's not going to be around that long. I've known Phil for many, many years and loved that guy and reached out to him. He found me on Facebook just recently. I said to him, hey, you know what keeps people fit is dog walking. Let's do something about that. So we decided that we would create a photo contest where you get out there and you put a mask on, of course, you have to be careful, and get a picture of you walking your dog. It's something that we can all do safely during COVID, but it's all ages, all communities, everybody can participate in this. You submit your photo with a $10 entry fee, which goes to White Whiskers because we are trying to erect this sanctuary. And then we have this voting process. You can submit the photos, started January 1 through February 13th. On February 14th, that's when people begin to vote with a Select Your Sweetheart, Valentine's Day. Phil loved holidays apparently, because he told me he wanted to recognize Valentine's Day as well as January 1st, as well as March 17th, which is when we will be doing the actual giving away of the prizes. So anyway, so it's just a thing where we're trying to promote dog walking, and you know, walking is great, but walking with your dog, in my opinion, of course, is just a little better. So so that being said, if you would like further information on this, please go to our website, which is White Whiskers, plural, WNY.org, whitewhiskerswny.org. All of the information about the contest is there. I'm trying to
Amazing.
be succinct. It's not my forte.
No, I was gonna say that was perfect. Thank you so much, Paula. And the prizes really are amazing for dog walkers or winter walkers. It's a great opportunity to just get out, get active, start your New Year's resolution right. And yeah, I'm really excited about it. The prizes are incredible. His and hers bikes, wonderful baskets with fitness activities. So there's really so many prizes. I think one, I could be wrong. Is it an air fryer or something?
Yes.
Yeah,
Healthier.
exactly.
fryer.
So, yeah,
Aria air fryer and rotisserie. And I'm not a cook, so that would be lost on me. But I know there's other people out there who would be.
exactly. So we're just so excited. That wraps up my portion of the presentation, but I would love to hear if anyone has any questions, any comments. I'm ready for them.
Well, Melissa, let's start with you. Have we received any in the chat room?
We have not.
Well, then we can chat amongst ourselves here. This dog issue is just so perfect that I always tell people they're lucky to have dogs that take them for a walk.
Mhm.
And then they're doing themselves a favor as well as the dog. But I'm not, our listeners may or may not be familiar with the organization that it's supporting. Can you elaborate a little bit more? How long have they been around? Are they local? Are they around the country? What? Tell us more about that.
You mean White Whiskers, sir?
White Whiskers, yes.
Okay. So we received our 501c3 Christmas Eve from the IRS, which was
Okay.
exciting. And
Congratulations.
we are local. We are looking for locations now. We want something between Niagara and Erie County because we have a lot of support from both of those counties. And we want a big old farmhouse. I do not want kennels. I want lots of gushy sofas and big dog beds. And I also want the place to be accessible to everyone because I know we can all benefit from dogs. So I want wheelchair accessibility. I want disability accessibility bathrooms. I want a big old kitchen where people can stash their lunch. I want a place where people who are dog deprived can come and spend the day with 9 dogs on their lap. I want, I also want emergency spots for people who are involved in house fires or have accidents. A lot of times you don't know what to do with your dog in that kind of a situation. I want to work with a lot of different agencies, Autism Services, People Inc., the VA, Mental Health Associates of Western New York. I want to work with all of those agencies, Compass House, to see how we can be of value to those folks too. I want emergency spots. I understand through the VA that a lot of veterans won't go in the hospital for procedures they need because they don't have the money to stash their dog. So bring their dog to me and for free, and I will look after him while you're in the hospital. And when you come out, your dog will be waiting. So we're going to be also like this kind of community masterpiece, if I may say that, which is going to benefit all of us, I think, in a really good way. And I know these plans are extremely lofty, but I just know I can do this. I'm a fundraiser, I'm a grant writer, and I'm an event planner. And darn it, this is happening.
Based on your enthusiasm, I wouldn't want to bet against you. Let's put it that way. Where are you? Is your home your office? Are you located someplace?
Not yet. I'm actually out of my house right now, where I have a couple of ancient dogs, Doug and Lucy, and I've had like a bunch of dogs because I tend to adopt the sickly elderly ones. So I have 27 boxes of ashes, but I don't have any 2-legged children, so that works out well for me. And I don't have to pay for college or rehab. Yay! So that works out as well. Sorry, I'm a little caffeinated today as well. Yikes. Never. Anyway, but we definitely will have this facility. I'm going to live there because I want a presence 24/7. I do not want the dogs being by themselves for 10 to 12 hours, which a lot of shelters are forced to do because they just don't have the manpower to do that. But I'm going to make sure I live right there. And yes, we'll definitely, I'm sorry.
Do you have a kennel associated with your house? Are the dogs, do you see dogs living in your house? And my follow-up question is, I've always thought, whether it's prisons, whether it's nursing homes, dogs that you're describing that others may not want could be so loved both ways in those types of facilities. Do you envision that at all?
I sure do. And right now I'm just in my house while we are looking for a location. So I just have my personal dogs with me here in my house. Once we have that location, what I'm going to want is a separate residence for me, very modest, just because I don't want a volunteer showing up at the end of my bed at 6 o'clock in the morning with a leash saying, hey, I'm ready to walk dogs. That'll be a little creepy for me. So don't want that to happen. So the dogs will be separated, but I'll still be near enough, and we'll have alarm systems built in. And I'm sorry, I already forgot your other question, and I know it was an important one senior citizens. A lot of people go into nursing homes and then they have to leave their dogs behind. I want to make sure that if that should happen, we at least try very hard to get that person to be able to either visit their dog, or we will get their dog to them. Because I think that's a critical part of the aging process. When you love dogs, you don't ever want to be without one. And I understand that completely. So my feeling is if we can get dogs there, and I'm open to wherever we can help. So if that would be the prison system or whatever, I'm good with that. If I can make it happen, it will.
And one last point, do you feel you'll have others helping you to have set up a not-for-profit? You have to show that others are involved. It's just not a personal crusade. Do you have others that have the passion for the mission that you're involved with?
We are unbelievably popular, which is great, much more popular than ever I was in high school. But we're great. I have 750 committed signed up volunteers already. And we have nothing really for them to do except help us network and get the word out. We don't have dogs to walk or anything like that, but that's how popular this is. Every time I mention this to anyone, they immediately drink this Kool-Aid and they're on board. It's great.
You and Phil must have been a wonderful team to get together.
They were such a good team, tag teamers.
Well, and I can speak personally about that. Phil, I could just drop in his office. You're located in City Hall. He was then, and chat. And he's a great listener. And immediately he would have a sense of what idea you were expressing. We do since 2016. Phil was the first person on board. We do a reflective walk after Pope Francis wrote an encyclical on care of our planet, Laudato Si. And every first Sunday from 10:45 to 11:30, we would meet near the casino in Delaware Park and go for 3 different walks in 3 different seasons, spring, summer, and fall. And he would be there for every one of those. And then we would reflect. I've uploaded the reflections on our webpage at imaginelifelonglearning.com. Just go to the audio catalog. And because the Pope invited us to stop, look around, and see beauty. And there are so many beautiful places in Buffalo, so that the Walk Western New York dovetailed nicely with the idea of all of the walks that Explore Buffalo does, that the Garden Walk promotes at the end of July every year. All of these are about something else, but they include the walking element, which then includes the wellness element. And finally, we were getting involved with the second Tuesday of June, and I hope to, in Phil's honor, keep pointing towards it. That day is called Global Wellness Day. You can go online and see, look up Global Wellness Day. And it's a newer organization that's simply pointing to wellness around the planet. So I thought that Phil enjoyed that connection. He had been aware of it as well. And as such, I think Phil's memory can live on with the passion of all those people who felt, including your 750 folks that are pointing to dogs, but we're all pointing to walks maybe along Grand Island, urban design issues about walkability and pedestrians and bicyclists. And Phil would just help encourage Go Bike, Explore Buffalo, many other organizations to do their thing because it fell under the umbrella of wellness, that a community that was working together and encouraging the microcosms to develop would end up in a macro community. And then we can move up the ladder for the Robert Wood Johnson's annual report. It should be an embarrassment to us that we are as low as we are. We've got a medical campus, we have a medical school, we have great hospitals, good people. We can do better. And I think in Phil's honor, we should try. And that's what I sense you doing, Lucy, to keep the Wellness Institute in front of us. And then if it's meant to be, people will gather around your leadership and do the best we can to do it for our sake and for Phil's.
Absolutely.
Dennis, I know we don't have a lot of time, but there was a question. Someone asked, are there opportunities for volunteering with the Wellness Institute? And Lucy, perhaps you can give some contact info for someone who maybe wants to reach out to you after this presentation.
Yes, absolutely. Thank you. And I also do want to thank so many people. I see so many people in here. I was looking while we were chatting. So many people have already donated to Phil's Mafia. So thank you all for your donations. And for anyone who wants to continue to reach out, all we want is connection, that social capital. So you can reach out to us at creatinghealthycommunities.org. You can email us, or you can email me at lucy@creatinghealthycommunities.org. I'm in and out of the office, so I won't give you a phone number, but we've got a Facebook page that is Healthy Communities 2030. So we hope that you engage with us. We'd love to connect with you. Lots of different opportunities to do it. Could be on walks, it could be on youth, it could be really whatever you're interested in. We just want to support people who are passionate about health and wellness, just like we are. So and thank you for putting the contact info in the chat. Please never hesitate to reach out because, we just love connecting.
I want to reinforce that. It's one thing for the money. I hope that Phil's Mafia campaign is built off of other successful names like that that have worked out well. But it's also the time. By the way, have you felt that you've raised money to help the Institute?
Absolutely. It's been amazing. We've raised about $5,000. So, and Phil passed away in November. So it's been like 6 weeks and we've already raised that much. So, and we're a small group, it's just amazing.
That's the point. That's the word of mouth. And I think people that knew Phil, it's the best way to at least channel financial resources. But boy, that question was perfect because it's your talents. Everybody in the community's got talents. And if wellness is a goal of individuals, then it becomes the goal of the community. And that's the talents you can bring to the table. So Lucy, as long as you help keep those people connected, literally in community, you will serve a great purpose, I think, for Buffalo, for yourself and all the others that want to honor Phil and continue his legacy.
So, I think so too. Thank you.
Time does have a way of creeping up here, so we will finish up here. Folks, thank you so much for joining us today. Join us next week, same time, same Zoom link, when we talk to David Granville. David, I've had as a speaker in years past. He's representing the Buffalo Public Arts Commission. We're going to hear about some of the statues that we sometimes go right by. How about David by Michelangelo on a Skajakwita, and the new Tesla statue in M&T Plaza, and probably a few more. So I'm Dennis Galucki. Be well, Have a good day and a good afternoon. Thank you. See you next week.